right. Good afternoon, everyone, and welcome to the Alaska Rural Health Transformation webinar. We are so thrilled to see all of you joining us. We have over 2,000 attendees that have registered for today's webinar. So due to the large number of attendees that have registered, we have muted all of you. We encourage that you would submit your questions in the Q&A box. If you look down below on the lower screen, you'll see Q&A and you could put your questions in there. Next slide. So the purpose of today's webinar is to share with you an overview of the Alaska's approach to implementing the Rural Health Transformation Program. We may say RHTP for short. We also want to introduce all of you to the Alaska Community Foundation. They are the grant administrator for our Alaska organizations. We're going to walk through with you what you can expect with step 1 of the portal and the letter of interest steps. And we're going to also outline for you what are the upcoming timeline and the next steps. We're going to leave time for question and answers. Now, as I said, we have over 2,000 participants that have registered, so we're not going to be able to get to everyone's questions. But I want you to know that we are scheduling office hours for the next 3 Tuesdays. That would be February 17th, February 24th, and March 3rd. We will have office hours from 12 to 1 p.m. each Tuesday. We will be posting that registration link on our website in the coming days. And today's focus is really about the step 1. Again, it's that registration, it's the letter of interest. We're going to be talking about that. And then once we get through that first stage, we'll be having more webinars on the next steps if your application is focused on that administrative readiness, that planning, or that project implementation. Remember that our goal for these projects is that we are supporting Alaska organizations as they're working through those 3 different pathways. We want to ensure that those projects are aligning to the RHTP goals, which really are ultimately leading to better health outcomes, sustaining our care delivery models here in Alaska, improving our health access. It's incredibly important opportunity for all of us, and I'm really excited to be working with each and every one of you. So I'd like to introduce our speakers today. If we could go back to the other slide. So with me today, we have Deputy Commissioner Emily Ricci with the Alaska Department of Health, Betsy Wood, the Associate Director with the Alaska Department of Health, and with the Alaska Community Foundation, I'm very pleased to introduce you to Alex McKay. She's the President and CEO, and Megan Casilia, I'm pretty sure I messed up the last name, who's the Vice President of Programs and Grants. So thank you guys all being here today, and I will pass it to Emily that will talk about our goals and our proposed funding uses. Next slide.
Hi, everyone. Good morning, good afternoon. I don't think it's evening anywhere, but in case you're touching on evening, if someone's way over on the other side of the country, welcome. My name is Emily Ricci, and I am the Deputy Commissioner in the Department of Health. And if this is like your 3rd webinar with us, or you've heard these presentations before, we're going to keep it high level. But if you have not, it's really important as we begin to talk about the process and the first steps for beginning the implementation of the Rural Health Transformation Program. I want to make sure everyone is always thinking about how does the concept or the idea that you have that will support Alaska's communities in achieving the goals and initiatives, how do they tie back to the state's application? How do they tie back to the 3 goals on this slideshow? And how does it tie specifically into the proposed funding uses? So we have 3 goals that were outlined in our application. The first goal I think about is the people. The second is really the systems and the payment. And then the third are the resources and tools that we use to implement and achieve goals 1 and 2. So within each of these goals, you'll see 6 different colored boxes. Each one of these boxes represents probably 19 plus pages of proposed funding uses that are outlined in our application. We haven't figured out a way yet to fit it all into one PowerPoint screen, so we're going with colored boxes. But it's really important to review the proposed funding uses. They are online, and they outline in much more detail the types of ideas that we heard from Alaskans when we were drafting the application. And those are going to form the basis and kind of the parameters of funding uses for the Rural Health Transformation Program. So you see here in Goal 1, we have healthy beginnings, healthcare access, and healthy communities. If you go online and review the proposed fund uses, you'll see more detail for each one of those. Goal 2 is, again, those systems. How do we ensure that the transformative activities, right, providing better health outcomes that are affordable and sustainable, right? Because that's ultimately our goal, the North Star of this project. How are we supporting that with the funding systems? And then goal 3 is our workforce, our people, our most valuable resource, and our technologies. How do we think differently about some of the work that we have today? So it's very important, again, to go in and read the proposed fund uses. And as we move forward, we are really focusing on those 2 overarching, like kind of our North Star, which is better outcomes that can be provided sustainably for our communities. So please keep that in mind as you're thinking about your projects and you're thinking about how those tie back. There's 2 areas that come up consistently, and I think we'll get into this in FAQs, but we get a lot of questions about renovations and we get a lot of questions about recruitment and retention. So how do you think about those as tying into the proposed fund uses and the goals? We have a lot of questions sometimes about renovation. If we want to improve healthcare access or even healthy beginnings, right? We hear requests for renovations for different facilities in order to accommodate better access to people who need services. We are still working to get definitions on what the extent of renovations and the definition of what is allowable for renovations. But if you are thinking about a project, again, the project is intended to support the goals of the Rural Health Transformation Program. So be thinking about what do you need to achieve those goals, not how can I use this money to meet a renovation need that has remained unmet for all these other reasons, right? So everything needs to tie back to our goals. And then, on the other side of the spectrum, we have strengthening the workforce. And so looking at some of the requirements at the federal level and with the notice of funding award, even the federal statutes, if you're thinking about a project that involves incentives, whether that is recruitment and retention incentives or others, you're going to need to be aware as you're designing this project that there's a 5-year commitment that is required at that federal level that ties to these incentives, particularly if they result in a certification. So again, this is the first step in the process. There's a lot of details. This is a complex program. Our goal through this process is to help you navigate that. If you have an idea that ties into the goals of the program, right, is Alaska-based, serves the Alaska communities, we want to help you through this process identify how to move that forward in alignment. And this is just the first step. So with that, I will pass it off to Betsy Wood, who will talk about the next set.
Thank you, DC Ricci. And if we could move to, we did move to the next slide. Fantastic. So thank you all for being here today. My name is Betsy Wood, and I'm an Associate Director in the Commissioner's Office of the Department of Health. I'm going to walk us back through the Rural Health Transformation funding timeline, and I'm going to highlight a few key dates and expectations that are really important for anyone who's considering applying as a subrecipient to keep in mind as you kind of build out your project ideas. So again, this is Rural Health Transformation Program funding, and it is awarded annually to the state by CMS over the course of 5 years. So each year is its own budget period. And the first budget period is shorter than future years. I think that's really important for us to keep in mind. That budget period began at the end of December 2025, and it runs through October of 2026. Each year, we have 2 years to allocate and spend funds from each budget period. So what that means is that for the first year, we have until October of 2027 to finish spending the first year's award. So even though I said this is a 5-year program, we really need to be thinking about each year individually as an annual federal award to the state. And that means that the state must apply for the next year's funding by submitting what's called a non-competing continuation application, or an NCC application. That's an application that the state will submit each year in late August. This is a way for us to, communicate to our federal partners, here's our plan, here's how we're progressing, this is what we're thinking for the next year. The CMS team will review our progress that we've made over the prior year. They'll review our plan for the next year, and that's going to help them determine the next year's award. It's important to be thinking about it again in these terms of annual awards, because beginning in March of 2028, CMS is going to begin sweeping unspent funds and redistribute them across states. That really just means that we want to be thoughtful but move fast, because we really want to leverage our first year funding and our next year funding so that we can have these dollars really make an impact. That is going to be important, and we'll talk about it a little bit later. When you think about what are you ready to implement right now, we want you to really be thinking about where are we ready to move, where are we ready to go. That will help our state work together to effectively leverage this opportunity. As we've said before, this is one-time funding, and that means that CMS is really expecting states and our partners to use rural health transformation dollars for strategic investments that can be sustained after the funding period ends. So as DC Ricci mentioned, this isn't really meant to fill in kind of an existing gap or an existing funding hole that you have. It's really meant to say, what projects do you have that meet the goals and the desired outcomes of the program, and how can we use these funds to move our state forward? It's also important for everybody to be thinking about that we have ongoing reporting requirements where the state will be reporting to our federal partners, how are we doing? How are we progressing towards those goals? How are we effectively leveraging those funds? That means that the state will be submitting regular programmatic and financial reports to the Centers for Medicare and Medicaid Services, including an annual progress report each August that will directly affect future funding decisions. So if you receive RHTP funding, we're going to ask that you provide us with timely and accurate information so that we can meet those federal reporting requirements, so that we can communicate to our federal partners how we are collectively advancing towards our goals in Alaska. We do anticipate that CMS, the Centers for Medicare and Medicaid Services, is going to release more detailed reporting guidance in the coming weeks, and we will be sharing that out with you. We will do everything we can to articulate upfront, here's what we'll expect from reporting, here's what we've been asked to carry forward. I just want to put that out there that as we receive more information, we'll be sharing that out with our partners so we can all start from the same knowledge base. For project implementation grants in particular, I think we'll start talking about the different funding pathways that we're building out underneath this program. Many of you are already probably familiar with the different pathways that we're building out for folks. But if you're proposing a project that's really like a full project and ready for implementation, as you start to think about, how are you going to communicate and shape that for us, that readiness and capacity to execute will be very, very important, especially for year one, which has that shorter spending time frame that I discussed already. So as you prepare to submit your letters of interest, we encourage you to consider the overall project portfolio that you're proposing. Ask yourselves, does my organization have the capacity to execute everything that we're submitting for year one within this first year time frame? It's really important to be thinking about that holistically, because year two is right around the corner. And when you're proposing your projects and your ideas for year one, we want you to think about, How you can put together a strong proposal that reflects a clear understanding of what you're confident you can successfully execute. So think about those compelling projects that you have that are well aligned with the goals and desired outcomes. And it's okay if you're not ready for a full implementation project yet. That's why we're including the planning and readiness funding for organizations that need support to build capacity or shape a concept before launching into those implementation phases. And next slide, please. So this slide reorients us to how the Rural Health Transformation Program is structured and who's playing what role. As a reminder, this is a federal grant that operates through a cooperative agreement with the Centers for Medicare and Medicaid Services, meaning there is ongoing partnership, oversight, and accountability. CMS is going to work closely with the state, reviewing our progress and our planned spending, approving our annual funding, and providing technical guidance over the life of the grant. The Alaska Department of Health is the lead state agency for the program. The department is responsible for overall program design, managing funding and alignment with federal requirements, and ensuring that the RHTP activities advance Alaska's rural health priorities. We're accountable to CMS for performance and for reporting and for articulating our uses of funds. So to support our effective and timely implementation, we have partnered with the Alaska Community Foundation. I think you all have seen them and heard them. You'll be hearing from them in a moment, but we're thrilled to have them on board. They're an Alaska-based organization. They have strong relationships across the state and a deep track record of managing large funding programs on tight timelines. So through this partnership, Alaska Community Foundation will be administering grants to community partners, which includes managing the project application process, supporting organizations as they apply, distributing funds to the approved projects, and providing ongoing administrative support and assistance over the life of the program. Our community partners, such as hospitals, providers, tribal health organizations, community-based organizations, and other eligible entities, will apply for RHTP funding through the Alaska Community Foundation rather than applying directly through the state. We've convened an advisory council that plays a strategic advisory role. The council provides input and perspective to help ensure that the program is implemented in a way that's effective, sustainable, and responsive to Alaska's needs. They will help inform program direction and priorities. So with this context in mind, I'd like to turn it over to Alex McKay from the Alaska Community Foundation to begin to discuss the letter of interest process and what applicants should be thinking about as they prepare to apply.
Great, thank you, Betsy. Before we walk through the grant process, I just want to take a minute to share why Alaska Community Foundation is so pleased to be supporting this work. We really exist to support what Alaskans care about now and the future, and the rural health transformation is so important, and that really aligns directly with our purpose. It's been a pleasure partnering with the Department of Health to design and administer this process that we make sure is fair, transparent, and intentionally structured to support and encourage innovation across Alaska. We want you all to apply and be creative and come up with ideas as long as it fits in with the parameters. Our role is really to just bring our professional grant-making expertise, how to structure the processes, supporting the development and implementation of strong proposals, and steward public services responsibly, while making sure all of you as applicants have clear pathways to participate. But most importantly, it's really about supporting solutions that are, locally informed, really meet the local needs, sustainable, and are really able to strengthen our rural health system over time. But with that, I'll walk through our anticipated grant timeline so you can see how the process is really designed to support projects at all different stages of readiness. So this shows really the full arc. We want you to see from registration through different grant pathways and how this really will support you at different stages of development. On the left side, you'll see the registration and letter of interest. Everyone begins at the same place, it's the same door. The registration and letter of interest are open from February 17th through March 11th, and all applicants use this portal. The purpose of this is really to give the Department of Health an understanding of what your idea is, and then be able to route it to the right pathway. It's really about fit. It's not really about ranking. We just want to see where you are at in the stage. There are readiness and planning grants. In April, we'll anticipate awarding kind of 2 early stage grant types. The readiness grants really support early work, where you're planning, testing feasibility, developing partnerships, and engaging with the community. So these are ideas that kind of show promise, but you really need space to develop them. Next, we have planning grants, and these support things that are a little more designed and have a defined health system intervention. You know what you want to build out or develop, but you need time and resources to design it further. Projects that are ready to move forward are really will receive will be invited to submit a full proposal and in March to really implement things that are really ready. It'll be ready, high impact projects. There's demonstrated feasibility, strong partnerships, and you have the capacity to deliver. There is this other category, targeted innovation grants. That's a pathway that's different. It's really designed for prioritized statewide initiatives that the Department of Health develops. And these will be launched through targeted processes rather than this open application. And that timing is to be determined. So we know that not every strong project starts at implementation, and that's intentional. Some people are really ready, or some organizations, but we really want to support innovate movement from readiness to planning to implementation over time, because we want the projects to go forward. We want your ideas to be considered and funded through this. We really want a strong, balanced portfolio that reflects our diversity, geography, and real world needs. So at this point, I'm going to turn it over to Megan, who's going to talk about what this registration looks like.
Thanks, Alex. So I'm Megan, the Vice President of Programs and Grants at the Alaska Community Foundation, and we're looking forward to opening our grant portal with the Rural Healthcare Transformation Letter of Interest form available this coming Tuesday. I'm going to talk a little bit about how to log into the portal, and what you'll be seeing is our test environment. So you'll notice some things like it says it says sandbox on the back of it. When you log in to the environment that's real, it won't have that, but this will give you a sense. Let me just click share here. So we'll have a link to the login page on our site as well as on the state site once it is available. When you go to log in, you'll have the option to log in with an existing account if you've already submitted a grant application through ACF's portal, or you can create a new account. When you create a new account, it will associate the account with organization. You'll need to enter information like the EIN tax ID as well as address information. Then you're going to have information about your contact information, whether you are the executive officer. It doesn't matter whether you are or not. We just need to know one way or the other. And then you'll set up a password. Once you log in, you'll see a list of our available opportunities. Again, right now, this is a test environment, so all you see is the rural healthcare. There may be other opportunities live when you log in. And what you will be doing is clicking on the apply button here to see the form and to begin filling it out. You can also preview the form here, and that will download a PDF that shows you all of the questions so that you can share that with anyone you're collaborating with. Once you're in the system, you can also connect other people to your organization. If you have any questions about that, again, these very specific application process questions and portal questions are things that we are going to be able to help you with at ACF. And so you can email us. We'll have the contact information at the end of the presentation. The other thing that I think is worth mentioning here is that if this is a project that involves a lot of partnered organizations, you're going to want to have the lead organization apply. You do not need to have every organization submit project proposals through this form. So just have that one lead organization submit. We'll go back to the slides and just give a quick overview of what you can expect to be asked. When you're registering, you're going to be asked for a project portal, some more details about the organizational contacts, including a financial contact, your total operating budget, your service area, which will just be a drop-down list, your organization type from a drop-down list. We already talked about the EIN. And then the other thing that's really important, and it's something that you could start right now, is your unique entity identifier. Anyone who receives federal funds needs to be registered with SAM.gov. And so when you register with SAM.gov, your organization is assigned a UEI, a unique entity identifier, which you will need to submit with this letter of interest. And so in the chat, I believe we are including information about how to register for a UEI through SAM.gov. You can also log into SAM.gov to search for your organization and see if you already have one. And so that's something that you can be doing this week if you don't know your UEI number. Then once you've entered your organizational information, we'll also be asking information about the project, whether it's at a concept stage or fully planned. And these are going to be high-level questions. So if we could move to the next slide. We're going to be asking, at, again, a high level, the problem or opportunity you hope to address, your proposed approach, the expected benefit to rural, remote, or frontier communities, the populations that are going to be served, the alignment with RHTP initiatives. We're going to ask you about your sense of readiness, timing, and resources needed, and potential partners. We'll also ask for a sense of how much you expect the project to cost overall, the overall budget. But we're just going to be asking you for a range. You're not going to need to submit anything detailed at this point. To that end, I just want to let everyone know up front that there's not going to be any document uploads. There's going to be fields where you're either choosing an answer from a set of potential options, or there will be a field where you can type in some text. But other than that, there's not going to be any place to submit more detailed documents. Those will be asked for later in the next step if your project is ready for implementation. And then the last thing here is also your potential partners. This is particularly important if you are applying from outside of state. It will be really important to talk about what kinds of organizations you are partnered with in the state, or how you expect to be partnered in the future. And so with that, I will pass it back to Commissioner Hedberg to wrap us up.
Great. Thank you so much, Megan. So I know that we provided a high-level overview of the first step. So again, next Tuesday, we are going to launch the registration portal. You will register your organization and you will complete a letter of interest. To stay informed, I really encourage all of you to visit the Department of Health website. There's a search bar type in Alaska Rural Health Transformation Program. It will take you to this page, or on the slide, you can see health.alaska.gov/RHTP. You can sign up for updates. So when we update this web page, you should be notified via email. And as a reminder, in my opening comments, I talked about 3 open office hours. So if you have questions about the registration and the letter of interest, we will have staff available with ACF to help answer those questions. We will also be having more webinars. We're going to be diving deep into each of the goals and each of the initiatives, in addition to walking everyone through the different stages of the application process. So with that, I know that we have some questions that are queued up and ready to go. I will pass it over to Dana, and she will be helping to facilitate the questions with the panelists.
Hello. First, I want to thank you all for submitting such excellent questions. We received a large number of questions both before the webinar and also they've been coming in through the Q&A, so thank you for that. But in the interest of trying to get as many questions answered as possible, I'm going to try to kind of combine similar questions. But the first one is for you, Commissioner. Can an organization that's in Anchorage or a non-rural area submit an LOI and be eligible for funds?
Dana, that's a great question. The answer is yes. Alaska has a hub and spoke healthcare system, and we know that non-rural areas, Anchorage, Fairbanks, Juneau, provide healthcare services to Alaskans living in remote and frontier communities.
Thanks. I'm also getting some questions for the Alaska Community Foundation. So if an entity is running into problems with the registration or the LOI next week, what should they do?
We actually have an email, rhtp@alaskacf.org for you to email, and we'll help you with any problems registering. And then remember that because questions that have to do with the application process and the grant process, that's really your way of getting a hold of us.
Thanks. And I just put that email into the chat for folks. Okay, so for entities that want to submit letters of interest for projects that maybe aren't quite ready to launch in year 1, should they hold off for future funding cycles? Let's get that one to Deputy Commissioner Ricci. Oh, you're on mute.
Should they hold off for future funding cycles? I think it depends. We are trying to design a program that will support entities in identifying, in building out concepts that can support the needs, the future needs of the healthcare system in providing, better outcomes, more efficient care close to home, right? Those are the goals. And so if you have an idea that has community support and is maybe won't be ready for a few years, but you believe that it is valuable enough to begin starting that process now, I would consider submitting a letter of intent for that concept, right? Because there may be opportunities through readiness or planning to build that out further. But please be thoughtful about what you do submit, right? Make sure it is something that, again, aligns with the community needs, is a serious project, and aligns with the goals of the Rural Health Transformation Program.
Great. The next question is about the letter of interest. So Megan, is there going to be a word count or a character limit on any parts of that letter of interest?
Yes, there will be character limits on all of the text fill-ins, and I think that we're expecting the maximum to be around 2,500 characters, but that's per field.
Okay, great. Okay, and then Betsy, there's a couple questions about timeline. So can you clarify, do projects for year one need to have all their funds spent by October 2026 or 2027?
Thanks for that question, Dana. I think the timelines are something that we're all still wrapping that takes time to wrap your head around. So for the first year, we need to allocate our funds. We need to have a plan that we've communicated to CMS for how are we going to across the state spend these funds by October of 2026. That's to have the plan. We have until October of 2027 to finish spending those funds. So if you apply for and receive funds out of year one, you have through October of 2027 to finish spending that bucket of funds. Now, I know that folks are also looking ahead and saying, I have work that I want to do, and it may cross over multiple years. And I think, Alex or Megan, maybe you can chime in a little bit, but I do think we're going to be looking ahead with asking for when we ask for the information, we want to know what your kind of proposed or projected future funding years are. Like I said, the state's going to have to go in and update our application with CMS every year. So we have funding for the first year, and then we'll have to go through that updated application process with our federal partners, and we'll see what the award is for the second year. There's some space for our federal partners to make adjustments to that. That's why we can't look ahead beyond this first budget period when we make solid commitments, but it's really helpful for us to know what are your projected future year funding needs so that can inform our future planning process too. But Alex or Megan, I don't know if there's any additional context you'd like to add about that.
There will be a question. We'll ask very generally. We're not asking for in that first part where you're going to give like a very detailed budget. We're just saying, what are you thinking? What do you think you plan to spend this year? What do future rounds look like? And particularly if you're asked to put in a full proposal, we'll get more detail, and that'll really help the Department of Health anticipate, or project, what to ask for in future years.
Thank you. So a little bit related, but can entities submit different LOIs if they're across different funding pathways, or how should entities think about the number of LOIs that they're submitting? Alex, could you take that one?
Yeah. So an organization can receive funding for multiple projects. And they may be at different stages. There may be the project that people have been working on or organizations have been working on that's really ready, but you actually already have ideas. You might have something else that's sort of right up in the hopper that's really in the planning stage, or some idea that you're really starting to think about, and that's readiness. So you can definitely receive funding for multiple projects across different pathways.
Okay, thank you. So kind of riffing off of that, Commissioner, is there going to be a cap on the number of LOIs an entity can submit, or a cap on the total amount of funding that one entity could receive?
Yeah, that's a great question, Dana. I would say at this time, there's not a cap on the number of letters of interest that an entity can submit or the total funding. But I would really say that you need to remember this is a 5-year federal cooperative agreement. And Betsy has done a really good job with outlining year 1, year 2, year 3, year 4, year 5, the timing. Year 1 is very short, it's very truncated. And so we are looking for organizations and their capacity to complete the work that they are proposing through their letters of interest. And so there's a capacity issue and ensuring that that organization can follow through with expending those funds within the time frame. Because there is risk that if an organization says they're going to do a lot, they're not able to accomplish everything for a variety of reasons, and we're not able to liquidate those funds within that time period. The state is at risk, and we could have our funding award lowered, right, in the subsequent years because of overcommitment by any one agency. So that's part of the thought process with the Alaska Community Foundation. looking at the readiness of the organization and the capacity that they have to complete whatever project they are proposing. And remember, all of this is really focused on aligning to our goals, aligning to the initiatives and those proposed funding uses that Emily talked about at the beginning of this presentation.
Okay, and then Betsy, I think I'm going to kick this next question to you. So if there's a group of organizations that are partnering together to submit an application, how should they apply?
That's a great question, because I think that we've seen a lot of, we know that there are a lot of partnerships, strong partnerships across the state where entities are working together on these goals. And we've seen some new partnerships emerge, or also people saying, hey, I really have this idea. I don't think I can do it all alone. So I think what's helpful to think about when you're building out your letter of interest and building out your future applications is you need to think about who are you anticipating will receive those funds. So if there are multiple organizations that are partnered together and you each are saying, hey, we're working together, but we each need to receive some funds in order to move this project forward, then each entity would want to submit a letter of interest and then ideally a full application. I think we're going to be asking about partnerships through this process so that we can kind of link that on the backside and recognize, oh, these three entities are working together. We want to make sure we evaluate that as look at that as a cohesive package. But if you're an entity and you're saying, I know that I'm going to need to contract with a vendor, I'm going to need to hire somebody, I'm going to need to kind of, do that type of a relationship where you want the funding to come to you and then you'll go out and contract with a specific entity, that would be one letter of interest for the group or the entity that's looking to receive the funding.
Thanks. I think, Megan, I'm going to ask you this question. Do organizations need to have prior experience with managing federal grants to apply or submit LOIs for RHTP funding?
So no, applicants don't need prior experience with federal grants. We're going to be providing funding and technical assistance to help organizations build administrative capacity needed for the management of the grants and the implementation of the projects. One thing, though, that is important is that in order to provide the funding for those initial readiness and planning grants, they do need to be registered with SAM.gov. So that's one piece that needs to be in place beforehand to be able to offer the funding.
How should organizations be thinking about submitting an LOI if they have like a really early concept idea? What kinds of activities could be funded? And I'll give that one to Betsy.
I think kind of building on what Megan and Alex have shared already is that, if you have an early stage idea and you're thinking about, we need to build readiness within our organization, we need to, be able to, accept and spend and report on, some of the uses of some of the federal funds. There may be resources that your organization needs to build up that capacity, but also, do you need help bringing partners together? Do you have kind of an early stage concept where you need to, get some assistance, putting some shape around that and assessing the feasibility and the practicality of your plan? Those are all the types of activities that could be funded through planning or readiness grants. But something to think about is that you don't necessarily need to identify in your letter of interest exactly where you think that you need to go. What we want to hear is your project concept. Where are you today? How do you see your project impacting the state and your community and moving towards the goals? And then, we may come back to you and ask some questions to help us understand the best fit for you, especially within this first year. So really don't worry too much about which pathway should I go after, where do I think I should be. It's really best if you can provide the information you have about your project, your concept, your partnerships, how far along you are. And then if you know that you're like, well, I really need some support in this area, if you can describe that to us too, that's really helpful.
Thanks. Okay. Still getting lots of questions about how, if there's an entity that's part of a larger organization, should they register separately or as part of their parent organization, use that same parent organization registration on ACF's website, and then submit separate LOIs? And then Megan, while I've got you, I'm going to kick that question to you. Also curious, there was a slide where you talked about service area selection. How should organizations think about that? Is that the service area for their particular project, for their general organization? What if they service multiple areas?
Great. So I'll start with the first one. Generally speaking, you're going to want to register with the parent organization and then separate LOIs for each project. As I touched on briefly in the presentation, there will be the opportunity to submit project-specific contact information. And so if you have different people in different departments working on different LOIs, you will be able to reflect that when you are submitting the proposals. And so generally speaking, you apply with the parent organization and just indicate the sub-organization or the department in the application. If that, for some reason, doesn't feel like it will work for your organization, reach out. And it may be a special case, but I would say 99% of the time you're going to be applying with the parent organization. Then the other question you had about service areas. There is the opportunity to indicate that you're multi-regional or statewide. And so we would ask that you reflect the regions that you serve, and there will be a later question that asks whether you are serving a single community within the region or multiple communities or part of a hub and, or if you're participating in a hub and spoke network where you're serving a wider network than maybe the particular community where you're operating. You'll have the opportunity to reflect that in the LOI.
Okay, thank you. So this next question is for Deputy Commissioner Ricci. So if there's a vendor organization that's outside of Alaska, should they submit an LOI if they're interested in partnering with an Alaska organization?
Yeah. One of the big opportunities, one of the many opportunities I see with the Rural Health Transformation Program is the ability to bring in ideas, concepts, technologies, workflows that maybe aren't utilized right now in Alaska, but could be adopted and implemented effectively by different Alaska-based organizations. And again, when we go back to the intent of the Rural Health Transformation Program for Alaska, it is support Alaska organizations and communities in ultimately improving the health outcomes in a sustainable and affordable way for Alaskans, right? So if you are an entity that has no connection to Alaska and is not connected to a community-based organization or a healthcare provider that is rooted here in Alaska, I don't know how you could effectively meet the need of Alaskans. And so we will be asking for some of those questions in the letter of intent to really make sure that as we look at different ideas moving forward, that those are tied to and deeply rooted to Alaska-based organizations and entities that are on the ground practicing and providing services to Alaskans today.
Thanks. And then Alex wanted to ask you, there's some questions just kind of wanting to reiterate the timeline around the portal and when organizations should expect to hear back. And also just sort of the process after an organization submits the LOI, who's going to review it, and when should they think about hearing back?
Well, as Megan said, the portal will be opening next week, really getting that pulled together. And then after that, the Alaska Community Foundation, the Department of Health have a process where we're going to be kind of preparing and reviewing the letters of interest together. And organizations should expect to hear about the next steps by mid-April when some of the initial grant making will start for the first two categories. And projects that are ready to move forward will be asked to submit a full proposal in March. And that's the timeline. Was there another part of that question?
Oh, I think you covered it.
All right.
Okay, so we've kind of touched on this a little bit, but I'm going to ask it again because I think there's still some benefit in clarifying. An organization that has lots of ideas, how should they think about sort of the totality of all of the letters of interest that they're submitting? Should they err on the side of submitting all of them as separate LOIs, or how should they be thinking about that? I'm going to give that one to Deputy Commissioner Ricci.
So Dana, just to summarize, I mean, if they have multiple projects, should they be submitting multiple letters of interest or intent?
That, and also how should they be thinking about the total portfolio of projects that they've submitted? Like, should they submit only the projects that they're able to actually, if they're able to actually implement all of them?
So again, I would think about the projects in the context of the people that you serve and what that looks like over the length of the Rural Health Transformation Program, right? So if you have some projects that may need to be built out now from a feasibility or a readiness or a planning standpoint, because they might not be ready for implementation until years 3, 4, and 5, I would consider submitting a letter of intent so that when we are aware of this, right? Because again, part of what we want to do is we want to help identify areas where we see partnerships or I hate the word synergies, honestly, but like parallel efforts that are occurring across the state or across different areas. So again, if this is a serious idea that you believe has merit and aligns with the goals for the community you serve in the program, but maybe a few years out, it may be appropriate to submit a letter of intent so that we are aware that you are thinking about this and there may be support for readiness or planning, right? And so what we're really trying to balance is like, don't throw all of the spaghetti against the wall and see what sticks. It really is, how are you thinking about these projects and these ideas within the context of the population and the community of Alaskans that you are trying to serve in order to achieve the overall goal? And we know that some projects are going to occur over multiple years, and there's going to be different phases within that. So thinking about submitting letters of intent that outline the different elements of those projects, but how they tie together as a whole is how I would be thinking about it. If I'm an organization that might have 3 different projects, one may not be ready until year 4, one may be ready in year 2.
Thank you. Is the state going to be prioritizing the projects that are implementation ready in this first year? I'm going to give that one to Commissioner Hedberg.
Yeah, Dana, that's a great question. And I've been trying to answer questions in the Q&A, but there's like there's 139 questions. So I would say, remember, year 1 is really short, right? There's a short runway. So it necessitates that we do need to prioritize project implementation, but we want to care for those agencies that need that readiness support or that planning support. So you are going to see a blend. Year 2 is right around the corner, if you remember that timeline. So be thinking thoughtfully again about what you are submitting. Do you have the capacity to do this amount of work in year 1, or do you want to spread out this work over that 5-year timeline? We're really asking you to really help prioritize what is most meaningful for you and your community. And if I may, Dana, I'm just going to add on We are starting to have starting the conversation around regional planning that will start this spring. We've already heard from some communities that have already come together and they're starting those planning efforts. And I think that is going to be a really good guide to help all of you in community to identify where are you at? How can you improve your health outcomes? How can you strengthen your care delivery models in your region? And when you identify those gaps, how you can leverage the RHTP funding to address those gaps in those care delivery systems in your region or community. Again, so we have our North Star of Healthier Alaskans. All of this is predicated that we're also cognizant of sustainability, right? That we're thinking of sustainability. Back to you, Dana.
Okay. Kind of a follow-up question to the question about if we're prioritizing implementation ready. Are small projects as competitive as large projects? Are we looking for bigger projects? Let's do a speed round. Back to you, Heidi.
Great. Yes, I'm really good with the speed rounds. You know, we're looking at the entire state, and every community, big and small, has needs, and we're going to care for those communities to make sure that it's equitable across the state. Again, the focus is on our rural communities and how we are supporting our rural care delivery system. We know that it has a statewide impact. And so we're going to be looking at that process of that hub and spoke healthcare system, caring for our most smallest communities, our most smallest nonprofit or organizations, I should say.
Okay. Another quick question is, are there any organizations that aren't eligible? Like, is it just nonprofits that can apply? And do you have an answer for that one?
Yeah, I would say that all organizations are eligible, but we need to ensure that all organizations are following our federal guidelines. So as an example, we can't pay for lobbying. Individuals that want to have an individual project that's not an organization, they are eligible to apply, but that's not really the appropriate use for the RHTP.
Okay, great. I know we're getting close to closing here, so I want to make sure to ask this question. Can you clarify when the office hours will be and kind of what to expect during those office hours? And I'm going to go ahead and post the dates in the chat again.
Great. So for the next 3 Tuesdays, we are going to have office hours. It's not on our website right now. Give us some time so we can set up the webinars. We'll set up the registration and you'll be able to register and participate.
Great. Well, just 1 minute left. Any closing remarks?
Thank you, guys. We've had a great participation in this webinar. Please keep the questions coming. We're going to aggregate those questions and post the answers on our website. We really appreciate all your thoughtfulness and interest in the Rural Health Transformation Program. Thank you for participating. Bye-bye.